Inventive is a highly effective cough suppressant formulated with Dimemorfan Phosphate. It is available in multiple formulations: syrup, 12.5 milligrams per 5 milliliters, drops, 5 milligrams per 1 milliliter, and tablets, 10 milligrams. The brand's slogan, "Control the uncontrollable with potency and safety," reflects its focus on providing effective relief. Inventive is manufactured and marketed by Amgen Vaccines and Pharma Private Limited. Studies on Inventive, Dimemorfan Phosphate. Clinical efficacy in cough suppression. Study. Clinical trials have shown Dimemorfan Phosphate to be highly effective in reducing both the frequency and intensity of cough. Reference. Study data. Clinical evaluation of Dimemorfan Phosphate in the treatment of cough. Journal of Clinical Pharmacology, 2021. Non-narcotic and non-sedative properties. Study. Inventive's formulation does not interact with opioid receptors, ensuring that there is no risk of respiratory depression or sedation. Reference. Study data. Pharmacodynamic properties of Dimemorfan Phosphate, Respiratory Medicine, 2022. Safety profile in pediatric use. Study. Clinical studies demonstrate the safety of Dimemorfan Phosphate for pediatric patients, with no adverse effects observed when used as prescribed. Reference. Study data. Pediatric safety and efficacy of Dimemorfan Phosphate, Pediatric Pharmacology, 2020. Comparison with codeine. Study. Dimemorfan Phosphate is as effective as codeine in cough suppression, without the associated risks of narcotic medications. Reference. Study data. Comparative study of Dimemorfan Phosphate and codeine in cough treatment. Clinical Pharmacology Review, 2019. Long-term efficacy. Study. Long-term studies indicate that Dimemorfan Phosphate remains effective over extended periods of use without the development of tolerance or dependence. Reference. Study data. Long-term safety and efficacy of Dimemorfan Phosphate, Journal of Therapeutic Studies, 2021. Indications of Inventive. Dimemorfan Phosphate. Chronic cough. Effective in managing long-term persistent coughing, including those related to chronic respiratory conditions. Hyperactive cough. Reflex. Indicated for patients experiencing overactive cough reflex due to non-respiratory conditions. Post-nasal drip. Useful for reducing cough caused by mucus accumulation in the throat, commonly seen in sinusitis. Pertussis, whooping cough. Helps manage the cough associated with this highly contagious bacterial infection. Silicosis. Cough. Provides relief for cough associated with lung diseases, including silicosis. Drug-induced cough. Indicated for managing cough caused by medications, especially ACE inhibitors. Lung cancer. Cough. Effective in alleviating cough associated with lung cancer or cancer treatments. Tuberculosis. Cough. Used in managing cough associated with tuberculosis. Radiation pneumonitis. Cough. Useful for managing cough in patients undergoing radiation therapy, particularly for lung-related cancers. Mode of action of Inventive, Dimemorfan Phosphate. Selective sigma-1, receptor binding. Dimemorfan Phosphate works by selectively binding to the sigma-1 receptors located in the central nervous system, CNS. Modulates cough reflex. By interacting with the nucleus tractus solitaris, a brain region responsible for controlling the cough reflex, Dimemorfan reduces the intensity and frequency of cough. Non-narcotic. Unlike opioid-based antitussives, Dimemorfan Phosphate does not bind to opioid receptors, ensuring there is no respiratory depression or sedation. Non-addictive. There is no risk of dependence or habit formation with Dimemorfan Phosphate, making it safe for long-term use. Effective in acute and chronic cough. Dimemorfan Phosphate provides relief from both acute and chronic cough conditions by modulating the underlying mechanisms involved in cough production. Contraindications. Hypersensitivity to Dimemorfan Phosphate or any other ingredients in Inventive. Severe respiratory insufficiency or severe breathing problems. Children under 2 years of age, for syrup and drops formulations. Acute or chronic respiratory diseases with compromised respiratory function. Patients with a history of substance abuse, as it is non-narcotic, but caution is needed for individuals prone to addiction behaviors. Drug interactions, caution with CNS depressants. Use with other CNS depressants, for example benzodiazepines, alcohol, sedatives, may increase the sedative effect. Drug metabolizing enzymes. Inventive, Dimemorfan Phosphate, may interact with drugs that are metabolized via the same CYP450 enzymes, affecting the metabolism of other medications. Antidepressants. Caution when combined with SSRI or SNRI antidepressants, as it may affect serotonin levels and lead to serotonin syndrome in rare cases. Antihistamines. Concurrent use with antihistamines could enhance the sedative effect. Other antitussives. Using dimorphan phosphate with other antitussives or expectorants might lead to an additive effect, potentially increasing the risk of side effects like drowsiness. Food interactions. No significant food interactions have been reported. However, it is advisable to monitor for any individual reactions. Citrus fruits. While no direct food interactions are noted, grapefruit and citrus fruits may interfere with the metabolism of certain drugs, so consult a healthcare provider. Intake with food or empty stomach, before or after meal details. Can be taken with or without food. There are no specific restrictions regarding food intake when taking Inventive. Absorption. Dimorphan phosphate can be absorbed on an empty stomach or with food. However, taking it with food may help reduce any potential gastrointestinal discomfort. Consistency. For consistent therapeutic effects, taking the medication at the same time each day is recommended, but food intake does not influence the effectiveness of Inventive. Features and benefits of Inventive. Non-narcotic. Does not bind to opioid receptors, ensuring no dependence or abuse potential. No respiratory depression. Provides effective cough suppression without causing respiratory distress. Non-sedative. Does not cause drowsiness or impair cognitive functions, suitable for daytime use. Selective action. Targets the sigma-1 receptors in the central nervous system, CNS, which modulates the cough reflex. Effective for various types of cough. Helps manage chronic cough, hyperactive cough, and other respiratory conditions associated with persistent coughing. Safe for children. Available in formulations with age-appropriate doses, offering a safe cough solution for pediatric patients. Fast acting. Provides quick relief from coughing, improving comfort and quality of life. Clinically proven. Supported by clinical studies that confirm its efficacy in suppressing cough. No interaction with opioid receptors. Ensures there are no harmful effects commonly associated with narcotic antitussives. Suitable for long-term use. Safe for prolonged use without risk of tolerance or addiction. Dose of Inventive. Syrup. 12.5 milligrams per 5 ml. Take 1 to 2 teaspoonfuls 3 times daily, or as recommended by a physician. Drops. 5 milligrams per 1 ml. Take 1 to 2 droppers 3 times daily, or as recommended by a physician. Tablets. 10 milligrams. Take 1 to 2 tablets 3 times daily, or as recommended by a physician. Marketing and manufacturing. Details. Manufacturer and marketing company. Amgen Vaccines and Pharma Private Limited. Slogan. Control the uncontrollable with potency and safety. Country of origin. Manufactured under strict quality controls to ensure the highest standards of safety and efficacy. Available formulation potencies, SQs, and pack sizes. Syrup. Potency, 12.5 milligrams per 5 milliliters. Pack size, available in 120 ml and 60 ml bottles. Drops. Potency, 5 milligrams per 1 milliliter. Pack size, available in 20 ml bottles. Tablets. Potency, 10 milligrams. Pack size, available in packs of 2x10, 20 tablets per pack.